Welcome to another presentation brought to you by Understanding Minds, a clinic specialising in reading, learning and developmental disorders, and by Understanding Words, an evidence-based reading intervention for children with reading difficulties and those at risk of reading difficulties. Hi, I'm Dr. Craig Wright. This presentation describes research that has been conducted by myself and Liz Conlon from the Griffith University Health Institute. We've been looking at whether a reading intervention program, Understanding Words, that's been demonstrated to be effective in a number of clinic settings, could be effective when run by paraprofessionals or teacher aides in a real-world setting using real-world children. What do we know about understanding words so far? We have studies that have shown that it produces statistically significant gains and large effect sizes on reading skills like word identification, phonological decoding, so your ability to decode unfamiliar words, and also importantly on reading comprehension. We've seen strong gains per hour, strong gains in reading skills per hour of intervention, and importantly those gains per hour have been equivalent to the gains in other studies reported in the literature. So it's at least as effective as other studies that have been reported. We've conducted studies that have shown that 84% of students who are involved in relatively brief interventions have normal or average post-treatment scores in phonological decoding, and at least half of the children, if not more, have been shown to have post-treatment scores in the normal range for reading comprehension. Trouble's been so far that the intervention studies we've conducted on understanding words have been run one-on-one. And that just simply isn't a cost-effective approach in schools. And we currently have no evidence that it can work under real-world conditions, or at least we didn't have before this study. And of course, real-world conditions are the conditions in which it's going to be run. It's going to be run in schools, mostly by teacher aides, using complex cases and frequently in small groups. So what are real-world conditions? Well, we live in a world of limited funding. Learning support, special ed settings are often underfunded by schools, and it's frequently the case now, certainly in Australia, that learning support specialists are actually doing special education. So they're working with children who are funded under conditions like intellectual impairment, severe speech-language impairment, and also the autism spectrum. And we also know that perhaps due to funding problems, most teaching is being conducted by paraprofessionals and/or parents. So the purpose of this study was to investigate if understanding words is effective when it's delivered by paraprofessionals under minimal supervision, working with normal learning support students. Now, what I mean by normal is that they're generally complex cases, so we're not talking the simple reading disability only type students who are used in most published research studies. They're complex cases. We also wanted to see whether understanding words could be delivered cost effectively. So again, could paraprofessionals, who obviously have to be paid less, run the program, and could it be delivered effectively in a small group setting? Okay, so this is the study design. So we didn't use any exclusionary criteria deliberately because we just wanted to include the types of kids you would typically see in a learning support setting. The control group was selected by the class teachers being average readers, and they were all above the 30th percentile on a test of reading ability. It wasn't a randomised study, simply by virtue of the fact that we were looking at good readers as controls, and we ethically couldn't remove or exclude any kids who were identified as having reading problems. We did, however, exclude some students from the study. So we excluded 3 children, one because of a global developmental delay. So the child was later diagnosed with severe intellectual impairment, autism, and a number of other developmental conditions, and he just couldn't even be involved in any of the lessons. He couldn't be grouped effectively. One child left the school, and one person who was initially identified as an average reader by the class teacher eventually became part of the treatment group. his data weren't analysed, so he's not part of the statistical analyses, but he did receive the treatment after I think the first month of the study. So what we were left with was 13 students in the treatment group. Most of them were complex cases, some with language impairment, some with some intellectual challenges, several with ADHD and a significant number of behavioural difficulties. They're all in grade 1, by the way, in a New South Wales school. And we had 13 in the control group, and those students were receiving the normal class instruction. So we tested them on measures of intellectual ability, word recognition, decoding skill, reading fluency, text reading accuracy, and comprehension. They were then involved, the treatment group were then involved in an understanding words intervention that ran most of the way across the school year. So they were involved in that 4 days a week, and the treatment was, or the teaching was delivered by 2 teacher aides, one experienced, one who was fairly new to the game. Both of them were naive to the program before they were trained by myself. It's another important thing to note about the study design was that the understanding words lessons occurred during the normal class literacy hour. So they were withdrawn from class and they received no other intervention or no other literacy teaching. The control group received their normal reading instructions. And that was delivered by a very experienced early grades teacher, mostly using Jolly Phonics type instruction. So the control group, one could argue, was essentially receiving a small group, roughly n equals 13, intervention themselves within the classroom. Okay, so the treatment itself was understanding words. Anyone who hasn't viewed one of these presentations previously can obtain more information from the Understanding Words website. As I've already noted, the children received the intervention 4 times a week for approximately an hour. It was delivered by 2 teacher aides who received a couple of days of training from me before we began, and it ran for the 4 school terms. Our results. Well, first of all, so we're looking here on this slide, the red bars represent the scores of the control groups. These are standard scores. So the average population mean is, the population mean is 100 on these tests. So you can see that the control group here were roughly average to begin with on a measure of word recognition. So that's their ability to just identify single words. The treatment group, who are represented in blue, were on average more than 2 standard deviations below the mean. At post-test, so this is right at the end of the year, the control group had improved a little bit. That effect was not significant. On the other hand, the treatment group had improved significantly more than the control group. So despite beginning the study as poor readers, their growth over time was actually more than the kids who were good readers, which is quite impressive. And most importantly, excuse me, all 13 of them ended the program or the treatment with their scores within normal limits, so above a standard score of 90 or the 25th percentile. You see similar results here with the word decoding measure, or their ability to use their knowledge of letter to sound conversion rules to decode unfamiliar words. Again, we're talking here standard scores, and the population mean is 100. The treatment group, so the poor readers, were below average to begin with, good readers much better. And what we're looking for here, the most important fact is that the longer the study went on, the smaller the gap between the 2 groups. So the treatment group, despite being poor readers and despite having considerable developmental difficulties other than their reading problems, closed the gap on the good readers, which again is quite impressive. And 12 out of 13 completed the study with scores within normal limits or above the 25th percentile. Okay, we can see here this is the text reading accuracy scores from the NEAL analysis. So the scores represented on the vertical axis are percentile ranks. Essentially, at the beginning of the study, the poor readers were almost non-literate, so they could hardly read any of the first story on the NEAL. At the end of the study, the mean was around about the 16th percentile. So they continue to have some difficulties with text reading, but they had improved significantly. Whereas in fact, the good readers actually, in fact, that difference there between the pre and post test was not significant, but you can see that there was a little bit of a slide in the scores of the good readers over time. So again, it's quite impressive that the treatment group has actually closed the gap, significantly so, on the good readers. And we can see the same thing in comprehension. The good readers actually improved slightly over time, but the improvement seen in the good reading group compared to the this is the comprehension score from the Wright. We're talking standard scores here. So the improvement seen in the treatment group from pre-test to post-test, or the end of the intervention, is actually greater than we saw in the control group. So again, in other words, they've closed the gap significantly. And we see the same thing with the NEAL analysis comprehension score. This improvement across time, across the 9-month period in the treatment group, is a really significant effect. So the conclusions we've reached are that, first of all, intensive intervention for 6 to 9 months can produce statistically significant and really clinically meaningful change in reading skills, even in these complex cases. Important thing is that teaching can be delivered effectively in small groups by teacher aides, and that's the most important piece of data or conclusion from this study, because it means that the intervention can be delivered cost effectively. We've also argued that it's made a really meaningful difference, not just to the children, but to the school. So taking those children out of the classroom arguably allowed the class teacher to deliver her literacy teaching more effectively to the children who remained in the class. So we increased the intensity of her teaching practice. And we've also, at the conclusion of the study, ended up with 2 teacher aides who are really well trained and really confident at delivering a reading intervention and with working and managing complex cases. And we can see here that this is a quote from one of the teacher aides, which is rather sweet. She said that, "I love understanding words. I wouldn't use anything else." Essentially what happened was the aides felt that the scripts, the explicit teaching, the directions given to them, and the sequential nature of the program meant that they had control. They didn't have to rely too much on the learning support coordinator. They knew what they were doing every lesson. They could plan for it, and they had the skills to cope and to be effective teachers. Plus, as they saw the intervention being effective, of course, that meant that they were getting rewarded for their behaviour. So essentially, the school is now left with those 2 very effective, well-trained and confident teacher aides who will be able to carry that across into the following year and hopefully into other interventions as well.